All right, good evening, everyone, and welcome to ATP Live Monday. I am Bemisela Boyde. I'm a pediatrician, and it's my pleasure to be here. So, thank you so much for joining us, whichever platform you're watching from, on Facebook, on Instagram. You're welcome to ATP Live Monday. I hope you've had a lovely day. All right. So ATP Life Monday is brought to you by Atp Pediatrician's Foundation, and we're committed to the health and to the welfare of your children globally. And so we are going to start by sharing the video so that everybody can see and everybody can hear. So I'm just going to do that first. But thank you so much for joining me. I really appreciate it. The welfare of your children. Okay, all right. So let me just do the sharing first. Uh, Welcome, everyone. So let me just do the sharing first. Welcome for those on Instagram. Thank you so much for joining. You're welcome. So if you have any question while we're doing the sharing, feel free to post your questions on whichever platform you're watching. So for those on Instagram, just put it in comment. For those on YouTube, you can put it in comment. For those on the Facebook page, you can also put it in comment as well. But for those in the group, you have to make sure you click on the video so that it will take you to the video proper, so you can post your question directly under the video, because that's the only way I'll be able to see it. All right, but feel free to drop your questions. Start with the age of the child, and then go ahead and talk about the issue you want to ask. Welcome. So I'm still sharing the video, and then I'm going to pin it to all our various platforms. So just give me a minute for me to do that. Okay, I guess I'm done with all my sharing. I just need to pin them now because some people won't say it, so we need to do the pinning. Okay. Okay, I think I'm done with all the sharing and all the pinning. Okay, Bolaji Adebayo Larita Mo, thank you so much for joining us. Welcome. Okay, so welcome everyone to ATP Live Monday. This program is brought to you by Atp Pediatrician's Foundation. You get to ask any question you may have about the health of your children, and then we answer them. And also, we do some teaching. And last week, I started talking about child survival strategies, and I'm going to continue with them today. If you have any questions while I'm doing the teaching, feel free to ask your question. The most important thing is to start with the age of the child. For us as pediatricians, we definitely need the age of the child to be able to answer your question. Start with the age of the child, and then you can start ask the question. Try and keep the information brief and straight to the point, and then you can now also ask your questions and how we answer them. So if you're in our Facebook group, you have to click on the video, because if you don't click on the video, we are not likely going to see your questions. So thank you so much, Loretta Mo. Thank you so much. I can see you. Good evening. We're blessed to have you today. Thank you so much for always being here and being consistent. I can't see people on Facebook. I hope oh, something is wrong with my Facebook. I hope there's nothing wrong. Okay, all right. But if you can see me on Facebook, just let me know you are there. All right. So when we talk about choice over strategies, we are talking about things that will ensure that our children do not die, but that they live. So, because a lot of children are still dying, about 4.8 million children under the age of 5 will die every year, and we're trying to see how we can reduce these deaths. Really, it's a lot, and majority of these deaths happen in sub-Saharan Africa, as we are all aware. And so, and we've investigated to know what are the things that are causing the death of our children and how can we reduce them. And so there are lots of uh, strategies or intervention that we know can help children um, who to ensure that our children do not die. And so those are what we call the child survival strategies. And they are not expensive stuff. They are very simple. They are what we call low cost technology. In other words, they don't cost so much money. You don't need to do too much. And yet they are so effective in reducing more than 75% of these deaths of children. So that is why it's important for us to be quite familiar with them. So I started sharing the F part last week. I talked about female education. I talked about health education as well. And then we're just going to continue with some of them as well this week. Okay, I just want to confirm that there's nothing wrong on Facebook, because I found that my Facebook is not showing. Let me just check on my Facebook page. That's Facebook. Okay, I think somebody is on Facebook now, so that means Facebook is working. All right, good. All right, okay. Okay, it's live, it's there. All right, so let's continue. Let me just say, I don't have any question. Good evening. So for those who are just joining, welcome. Feel free to post your questions. So let's talk about the first of the child survival strategies. We actually have an acronym from them. I'm just going to put that in the comment section. We call it Go Beef, the FR3, and then we have the T and the H. So those are the child survival strategies. And what does the G stand for? The G stands for what we call growth monitoring. Growth monitoring. And if you have been listening to us on Ask the Pediatricians Foundation or on any of our platform, you know we talk a lot about growth. And some of you are even very uh, aware now that whenever you're asking us questions, you're always putting in the weight of your child. So we always ask you, what was the birth weight? What was the current weight? Why so much emphasis on weight? Why every time that you go to the health center, we always insist that the children should be weighed? Because we found out that all those deaths of our children, we found out that one thing is the underlying factor in more than 50% of them, and that is malnutrition. In other words, no matter what other condition a child may have, once a child is malnourished, that child is already at risk of every other thing else. So malnutrition is like an underlying factor in more than 50% of child deaths under the age of 5. So that is why we always want children to have a healthy weight all the time, because when a child has normal weight, the child is thriving, they are actually able to deal with or fight some of these health conditions. So a child who is malnourished, for example, will not have diarrhea. is more likely to die from that diarrhea compared to a child who is not malnourished who have diarrhea. The same thing, a child who is malnourished and have pneumonia is likely going to die compared to a child who is not malnourished and have pneumonia. So that is why we pediatricians, you're always seeing us with our scales, with our tape measure. We are always checking the weight of the children because we want children to have good weight, and we should be monitoring our children's weight. I've been concerned in the past few months or years where some people will tell me they go for the to the health center to have their children's immunization, and the children were not weighed, and they say, oh, it's not necessary. No, it is very necessary. The children must be weighed every single time they step into an health facility. Can I repeat that? A child must be weighed every single time they stepped into an health facility. It doesn't matter what else they've gone there for. They have gone to see the doctors, they've gone to go for immunization. They must be weighed because weight monitoring, growth monitoring is one of the child survival strategies. And now it is not enough that the children are weighed. That weight must be plotted or must be analyzed. Those days we used to have what we call the growth charts. And then when we weigh the children, we plot it in those charts. If you have your immunization card, you will see there's a place that looks like graph where they put in like some lines. I'm sure some of you are familiar with what I'm talking about. And they're supposed to put the weight of your children there. These days we are all going techie, and so we all have our apps. And so, but then it is so important that we interpret the weights. That is another issue I have. So people ask questions and they start putting the weight of the children. And you can see from, I always ask parents to tell me what was the weight at birth, what is the current weight, and any other weights in between. And I found out that sometimes these children have been weighed and the weights have been dropping. And yes, there was no intervention. Nobody did anything. And that is even worse than not even measuring the weight at all. So when our nurses, our health workers, our doctors, when we check the weight of our children and we find out that weight is dropping or is not where it should be, we should intervene. That is the essence of doing that weight. So that if we pick up a child who is having any form of malnutrition, we can intervene, because once we deal with that, we know that child will be more comfortable, will be able to handle any other health issues. So weight monitoring is not just for an exercise. It must be interpreted. And if the child is not gaining weight, the weight is static, or the weight has even gone worse, it has dropped than what it was before, that child must be referred to see a pediatrician. It is very important. So if the weight is static, in other words, the way your baby a month ago and the weight is still the same, or the weight has even further dropped, that child must be referred to see a pediatrician, because we need to monitor the weight. We always want to make sure that our children have a healthy weight. Some children's weight can be too much. We don't want that. Some children's weight can be too little. We don't want that. We always want our children to have a healthy weight. So the take home from the child survival strategy number 1, which is growth monitoring: every time you step into the hospital, your child must be weighed. That weight must be interpreted to you. They must tell you the weight is okay, it's on the normal center, or it's not. If the weight is the same or it's falling below the normal centers, you must see a pediatrician. And these days we have many apps, free apps for you as parents to actually track your own child's weight. So if, for example, your health workers are too busy and they didn't have time to interpret the weight to you, you can pop in your child's weight, their dates of birth, and their gender into any of those growth monitoring apps that you can download on your smartphone, and then you can interpret it. If it is within normal center, anything above 50 centers will still be able to accept that. But if it's below that, you have to come and see us, because once a child's weight starts to falter, if a child is underweight, if a child is stunted in terms of their height, if a child is wasted, because of they are not having the appropriate weight, those children are at risk of other illnesses, their immunity will be low, they are prone to having infections, and then they are likely at risk of death from any of the other causes of death. That is why growth monitoring is so important. So we clip that. So if you have any questions, feel free to ask your questions. I'm just going to keep talking as I'm talking, but if you have any question, feel free to ask your question and I will answer them. Checking on Instagram, I don't have any question yet, so I'll just continue. Good evening, everyone. Okay, now we've talked about growth monitoring, which is the G in our chart of our strategies we call GOBIFET. And now I'm going to talk about the O, and the O stands for oral rehydration therapy. That one is very straightforward. ORT. I'm sure most of us are quite familiar with ORT. And I always tell parents there are things you should always have at home. At any time, at any time that you wake up, there are some things that as a mother you should always have in your house. You should always have paracetamol. You should have your digital thermometer because children can have fever any time of the day. So you must always have certain things like paracetamol. If a child is having fever and you need to quickly, reduce the fever, so you should always have your paracetamol. Another thing you should always have is your ORT, because children they can develop diarrhea. Okay, that is watery stool. And when children have diarrhea, the treatment for diarrhea is actually ORT. It looks so simple. It's so simple, but do you know that diarrhea disease is one of the top 5 causes of death in children under the age of 5? You will think that something so simple as watery stool, something so easily treated just using common ORT, should not kill children, but children are still dying from diarrhea disease. So it is so important for us to make sure that as mothers we have ORT. You can actually do your own as well if you don't have the one they sell in the pharmacy. If you have sugar and salt and water in your house, you can make your own ORT. I'm sure we've taught us before. If you go on our website, you will see all those the quantity. And when I used to grow up on NTA, those are the things they teach on TV. But these days, I'm not even sure whether those things are still being done. But then you have 5 cubes of sugar, a teaspoon of salt, and about 600 ml of water. Most of us have this measuring jug at home these days, so you can measure the water. You stir it, and that is your ORT. But if you don't want to stretch yourself, buy the one in the shop. The one in the shops is better because it also has some other things like bicarbonate and potassium. So I would recommend that. But just in case you are, in a situation where you don't have that, you can actually make your own salt sugar solution, and it's still very equivalent. So diarrhea should not be killing our children. When children have diarrhea, parents tend to focus on how are we going to stop the diarrhea. The diarrhea has not stopped. The focus in a child who is having diarrhea is not to stop the diarrhea. The emphasis is to rehydrate that child. What kills a child who is having diarrhea is not the stool. It is not the watery stool. It is the dehydration. It is the loss of water and electrolytes. So what the ORS does, the ORT, is to replace that water and the electrolyte that the child is losing. You forget about the watery stool the child is passing. Forget that one. Focus on replacements, replacing the water and the electrolyte using the ORT. That is the most important thing you need to do. And that is why you must always have oral rehydration at home. A lot of children still die from diarrhea. A mother still posted on our group just around Christmas, losing her child, and it's something similar. Children still die from diarrhea. It should not be happening. Nobody should be dying from diarrhea, because no matter how much food that child is passing, as long as that child is being rehydrated, as long as we are replacing that fluid that the child is losing, that child is not going to die. What kills them is the shock from the dehydration. So that is why we need to be replacing them. And if you are giving the ORT and the child is not able to drink, or the child is vomiting and the child is not keeping the fluid down, that is an indication that that child needs to go to the hospital. And in the hospital, we can put up an IV line. We can, rehydrate the child through the venous routes. But the most important thing is that at home, you give your children ORS. Okay. So I will stop there, and then I will take the question that Chinenye has asked. So Chinenye say a baby is 5 6 months old without teeth. That is not a problem. Most babies start to bring out their teeth from 5 to 7 months. Okay, so it is a range of 5 to 7 months, and then some babies may not even have their first tooth until they're about 13 months old, and that is also perfectly normal. So we don't need you to worry about the teeth. The teeth are going to eventually come out. However, I just need to let you know that the dentist wants you to bring your children to them for the first dental appointment when the child is 12 months old. Once the child clocks the age of 1 year, as you're celebrating the first birthday, there are other things you should remember to do. You need to take your child to see the dentist. You also need to deworm them. Those are the things you do at the age of 1 year. So you don't need to worry about that. All right, I still don't have any question on Instagram, and so I will just carry on. So I'm talking about child survival strategies. So I've talked about the first one, which is growth monitoring. Every time your child steps into an health facility, your child's weight must be checked, it must be plotted, and it must be interpreted. And then we've talked about the second one, which is the oral rehydration therapy. In other words, you must always have it at home. If your child has diarrhea, the most important thing to do is to rehydrate that child. That is the most important thing to do. Then, of course, the B. I'm sure all of you know what the B is. I don't need to tell you, but I will say just remind us, because this is something we talk about a lot, and that is breastfeeding. Okay, breastfeeding actually saves lives. Breastfeeding is child survival strategies. A lot of parents wonder why has the pediatrician ATP breastfeeding. Why? Because it's one of the easiest way to keep our children alive. It is one technology that works. Okay, and so when you see us being very passionate, when you see us promoting breastfeeding, the whole of the first week of August we devote it to breastfeeding week. We know we are talking out to you because we know it is one of those things that will ensure that that child does not die before their 5th birthday. Breastfeeding is one of them. Okay, and a lot of mothers always feel a little bit of guilt when we talk about breastfeeding, and they feel like, oh, as if we are trying to make those of them who do not breastfeed guilty. Or no, it is not. That's not the goal. The goal is not to make anyone feel guilty if you are not able to breastfeed or anything like that. No, but that does not mean we should not talk about it because we are trying to we don't want you to feel bad because you are not breastfeeding. No, because we're talking about something that can save lives here. So I always tell mothers that breastfeeding is more than feeding your baby. Okay, a lot of mothers think, is it not just food? I can also give formula. It's just the same milk. It is not, because breast milk is more than food. Because breast milk has all the things. It has antibodies. It has a lot of agents that keep children protected from infections like diarrhea, like pneumonia, which are the childhood killer diseases. So when we breastfeed the babies, we are protecting the baby from infections, we are protecting them from death. So it is not just about feeding their tummy with food. All the formula, the best of them, because a lot of people like to brag about the kind of formula they give their babies, whether it's from abroad, whether it's from US or UK, it doesn't really matter. All of them are, they are cow milk, and the best of them is still not close to breast milk. It's the best of them, and that is why you will see written on every kind of formula that breast milk is still the best for your babies, because there are things in breast milk you can only get in breast milk, you will never get in the formula. Okay, all those antibodies that you as a mother you have produced because you have been exposed to all these infections over the years, you have produced those antibodies, you pass them on to your baby through your breast milk. Your formula can never give you that, and those antibodies are even very specific to you, because it is customized. Each breast milk of every mother is different, from another mother's breast milk. So you are protecting your baby from these infections that you have been exposed to, which is common in your own environment. So especially breastfeeding in the first 6 months of life, protect your babies, and breastfeeding for as long as you can. even up to the age of 2 years, the better for the baby. There are many other benefits of breastfeeding, but when it comes to child survival, we found out that close to 1 million children will be saved if only their mother breastfeed exclusively. A lot of African mothers breastfeed, but we don't breastfeed exclusively. So we breastfeed, we give water, we breastfeed, we give formula. That is not exclusive breastfeeding. Exclusive breastfeeding means we are giving breast milk only for the first 6 months. And exclusive breastfeeding for the first 6 months will protect your baby against all those infections, diarrhea, pneumonia, even allergies, even eczema, some of those things, it will protect your babies against them. That is why we promote breastfeeding. That is why it doesn't matter whether your baby is born in the US or in the UK, whether NHS, whether AAP, all of us are unanimous to say the best way to feed a newborn is breastfeeding. Is breast milk. It protects that baby. Now, people abroad, because they have a lot of health system that is very good. They can, they have good water. They can easily get to the hospital in emergencies. Those of us, especially in sub-Saharan Africa, where most of our children are even dying, we don't even have that capacity. I don't know how many times parents will be asking questions. So this formula is so expensive, and how am I going to do it? What do I do? I'm like, your breast milk is the cheapest, and it's still the best. Even though it's cheap, it's still the best. Okay, so why do you want to even stress yourself buying formula when you don't have the money in the first place? When some of us don't even have good water, some of us don't have all this stress that go into making sure that you can actually do formula properly and safely. Most of us don't have them. But even when you can do formula safely and well, there are still things your formula cannot give the baby, and that is why breast milk is still the best way to protect your baby and to make sure that that child survives. So breast milk, breastfeeding, it is child survival strategy, and that is why you will see us promote it, because that is what ATP is all about. We are here to make sure that no child dies from preventable causes, and we know that one of those effective method of doing that is through breastfeeding. And so no matter how many people feel out about it, we are not going to apologize for promoting something that we know will keep our children alive and well. A lot of people send me inbox messages all the time, feeling bad and always trying to say, why are you always doing this? Why? I've given you the answer now, because it is a child support strategy. So we will always promote breastfeeding, and we're never going to apologize, and we're never going to promote formula feeding. Never. Okay, there are instances where babies can be given formula. Of course, sometimes the mother is not there and all that, but we know they are the exception, not the rule. So we don't talk about exceptions, we talk about what is the rule. Okay, so breastfeeding is the rule, is what we should be promoting, and not the other way around. All right, so we'll stop there, and let me take the next question I have from Omid K. Abigail. What can make a baby not be tall like his mates? Okay, so this is a question about height. Okay, so let's quickly talk about height. So number one, height is a genetic thing. Okay, you inherit your height tendency from your father and your mother. No matter how much we feed you, if your mom is short and your father is short, you will be short. It doesn't matter whether you eat all the best food in the world. So there are certain genes, there are certain things we inherit from our parents. So height is one of them. So for us to know what is for us as pediatrician, we do what we call uh, estimation of where your child's height will be. And the way we do that is by combining the father's height and the mother's height, doing some formula, and then we find what we call the mid-parental height. So we kind of estimate where your baby's height should be based on the father and the mother's height, and we plot it. There's a graph for that, for plotting it. So that will give us an idea to know, number one, is this child even have the genetic genetic inherit I'm looking for the right word, the ability to get to certain heights. That is number one. Number two, some people are just short. That is just who they are. There's nothing you can do about this. Then number three, there are health issues, which is now where we come in. So once we've established that the father and the mothers are not short, so the child has genetic tendency to be tall and the child is not tall, then we look for, are there medical reasons, okay, why the child is short? The first one is nutrition. If the child is not eating well, the child will be short. So we call it stunting. So a child will not get to their height because they are not having enough food. So we want that is one of the reasons why children have to be fed very well, so that they will not be short, they will not be stunted, because that is a malnutrition thing. Number two, children who have chronic health conditions like heart conditions, kidney conditions, congenital diseases, and so many other medical conditions that tend to be a long-term issue. Some of those kind of children can be short as well, and the solution to that is to treat their underlying medical conditions. Some children also have some endocrine disorders that can make them to be short and all that. So the most important thing, number one, is to make sure that the child has the number one, we measure the child, make sure that height is actually okay or not. We plot it on the chart. Number two, we check the parents' height to see where the child's height should be. And then number three, we investigate for medical conditions. So this question is so generic. If you suspect that your child is short, and then what you need to do is not to compare to the mates, is to compare to what is the normal. So you may think the child looks short, but we may measure the child, plot on the height chart, and find out that the height is still within normal. Or we compare to the what we call the mid-parental height, compared to what the parents, how tall the parents are, and it can be normal. So we're not going to do anything about it. But if the child's height is really low, less than the third centile, and the mid-parental height, the child is below the mid-parental height, and then we can now start to investigate for causes of short stature. There are many of them. I only just mentioned a couple, and then we can now deal with that. So there are specialists, pediatrician, usually the pediatric endocrinologist, that is their own area. They will do all the necessary investigations. Some children will sometimes we have to give them growth hormone. There are ways to treat it depending on the underlying cause. So sometimes if it's something we can treat, we'll treat. If it's not something we can treat, we'll let you know as well. But I hope I've addressed that question, Abigail. If not, just feel free to answer me. Oh no, there are questions on Instagram which I have missed. Okay, but let me quickly answer the question on Instagram because the question rolled away. Iberi Johanna say, is it compulsory to stand up and bump my baby after feeding him in the lying position? So Iberi, can you please let me know how old your baby is? So let us know the age of your baby. Every question always start with the age of the baby is very key. So for newborn babies, and it's good to to keep them upright after feeding them, especially if the baby is having reflux. So so you want to make sure that you keep them upright, bob them a little, so that at least the food will settle. Be 15 to 30 minutes before you put them down. Otherwise, the children can have they will have a lot more of reflux. Otherwise, that is it. Okay, then let's go to Miss Fumi before the question disappears. If your question has disappeared on Instagram, please feel free to repost it. I apologize for that. Miss Fumi said, I did exclusive breastfeeding and I'm glad I did. Oh, good. I'm happy to hear that. My baby is now 18 months old and I've never for once taken him to the hospital for any illness. Wow, that's amazing. Good. I think I should have all those my applause wherever. Okay, so but I'm happy to hear that. So yes, breastfeeding is a child survival strategy. So that is why people like us will keep promoting it. And I'm happy for you to hear that you had a very good experience. Pozak shoppers, good evening, Doc. Since you are talking about genetics, please, I'm concerned about genital size for my child. Yeah, so a lot of mother. Okay, Barry Joanna said your baby is 3 months old. Yeah, it's a good idea to still keep your baby upright after feeding, because they are still when they are still on exclusive breastfeeding and it's liquid. I've talked about reflux a lot, so I'm not going into all the details, but the idea is to make sure that the tendency of the milk to go back the wrong way and for the child to have reflux will be reduced if you keep them upright after feeding them. Yeah, but if you're not having much issue with reflux, you may not bother about it. Okay. All right. So let me go back to the question on I think you're talking about the penile size, if that is what you're asking about. A lot of mothers worry about the size of the children's penis and genitals and stuff like that. So there's a way we measure it. Okay, number one, just like I was answering the question on eyes, we need to measure first. Okay, we need to know whether that measurement is normal. So sometimes parents will say, oh, it is small, but then we put it in our measurements and it is normal. So the first thing is that you can see again, the pediatric endocrinologist as the expert in that. They have what we call, we have a measuring instrument for measuring the penile. We call it stretched. There's a way we measure. You have to first stretch it first before you measure it, and then we can compare it to what is expected for the child's weight and the child's age, and then we'll let you know whether it's normal or not. If it is not, then we can investigate. Most of the time, it is normal. Parents just worry. Sometimes for babies who are very fat, they have what we call the buried penis kind of phenomenon. In other words, because they have so much fat layers over it looks like it is short, but when they actually stretch it out and measure it, it is normal. But there are some medical conditions that can make children to have short penile lengths and all that. So the endocrinologist, again, that is a remedy to investigate and to do it as well. So feel free to see one of them in the teaching hospital. All right, Miss 359. Good evening. Is it advisable to give my kids measles vaccine that is going on now? Yes, you can. Why not? I've been vaccinated. Please note, I guess you mean they have been vaccinated with it when they were younger. Yes. So sometimes we give extra doses of vaccines. So extra doses of vaccines, measles is one of those vaccines that we give extras, because we know that children can still have measles. So we give measles at 9 months. We also give at 15 months. Now, the Nigerian government is trying to introduce what we call the measles rubella vaccine, not the measles mumps rubella, the MMR, but we are going with one M. So measles and rubella alone. And so we are now giving it to children, and it is safe. It is okay for you to take those vaccines. It will protect your baby don't have too much of vaccines. Too much of vaccines do not cause any harm to babies. At worst, it's a waste of vaccine, but at best it actually protects babies, because as babies get older, their immunity, their protection they've been given from the vaccines begin to drop. So that is why we give them booster doses. That is why when we know there's going to be an outbreak of measles, we will immunize all the children. We want to kind of booster their immunity before that outbreak or epidemic. So it is completely fine. Even if your children are taking all the vaccines before, it is completely fine to take either the booster doses or the supplementary vaccine. So the ones we go around giving children in the houses, at schools, we call them supplementary. They are like extra. They are not the routine one that your children are taking, but they are like extra that we normally give children when we are anticipating something is going to happen. There's going to be an outbreak, there's going to be an epidemic. We give the children another round of vaccines to kind of protect them. So that is the idea behind it, and it's completely safe. You don't have to worry about it. All right, we'll click that, and then let me see. Instagram people, the question rushed through, but I'm happy I've answered them. So let me just answer the question on Facebook. All right, Oluwale Folake. So my daughter of 10 years, who never for once bed wet, suddenly start bedwetting at school. What could be the cause and what the way out? And the child is in boarding school. Yeah, if the child is in boarding school, I think I saw it. Yeah, he said in boarding school. I have to be sure first that child is not being bullied or abused in school, because that is the first thing that will come to my head. So this is what we call secondary enuresis. So if a child who is perfectly toilet trained, perfectly dry at night, started to bedwet, something is wrong. And we really need to get to it. And for a child in boarding school, I really need you to go to school, and I really need to go and have a conversation with that child and have a conversation with the teachers. Something is definitely going wrong with that child. Either that child is being bullied, that child is being abused, or that child has a medical problem. So there are medical conditions like even diabetes, urinary tract infections, so many other conditions like that when even sickle cell anemia, one of the features of them is that children who are completely dry before, they will start to to bed wet. So we usually will have to investigate the child. So we do the urine test, we do the blood test, and all that. But 9 out of 10, actually, because of the scenario of a burden setting, I will worry that that child is not being subject to any form of bullying or physical abuse or even sexual abuse. So you really need to go quickly and go and see that child, and you need to have a conversation with the child and with the guardians or whatever the teachers to make sure that you know what is going on, and you need to bring the child home for the doctor to see and to treat properly. For those of us who put our children in boarding school, we really need to be more vigilant. So I know some of us feel like it's good, it's safe. A lot of things go on in those places, and sometimes the children don't want to tell you because they don't want to upset you and they don't want to make you to worry. But it's very important that we have that conversation with our children and make sure that child well-being, is safe. It's really very unusual for that to happen. All right. Omike girl said the father is tall. Okay, okay. I think you are answering the question about the eye. So, uh, you cannot on your own just decide the father is tall, mother is average. That is the job of doctors to do. The mother, the father, and the child have to go to the hospital. Doctors measure. We don't rely on face. You measure things, you plot things, and then you can have that conversation. And like I said, if they've done all that, then they can now investigate other causes of short stature. Okay. Gloria is saying, at what age are babies expected to have neck control? 3 months, averagely between 3 to 4 months. Usually by the age of 4 months, if a baby who is born at term, I always like to clarify that. If a baby is born at term and they don't have neck control by 4 months, I would be worried about them. So, but then if your baby is born preterm, because a lot of mothers, their babies are born preterm, but they don't talk about that, and they just go straight to the age. So for preterm babies, we calculate what we call the corrected age. Okay, so preterm babies are born earlier than normal. So we cannot expect the development to be the same as babies that were born at term. Term is 37 to 42 weeks. So if a baby is born at term, 37 weeks and above, because a lot of mothers also ask me, oh, my baby is 37 weeks, is my baby preterm? No, your baby is not preterm. Whether your baby is born at 37 or 42 weeks, they are still term. It's a 5 week period that is classified as term. As long as baby is born at 37 weeks and above, that baby is not preterm. Even if it's 37 weeks plus 1 day, it is not preterm. And we use that 3 to 4 months as the average age for that baby to develop neck control. But for preterm babies, for every week they are born earlier, we have to subtract it. Okay, so if a baby is born at 36 weeks, for example, when they are 2 months old, they're actually still 1 month old. We have to subtract 4 weeks from that. The same thing for babies born at 32. So we have to recalculate their age, calculate their corrected age. And so when we're comparing developments for babies who were born preterm, we use the corrected age, not the chronological age. The chronological age is the age based on the calendar, just based on how many months from what calendar dates they were born. That is the chronological age. But the corrected age is based on the gestational age that has been corrected. So how earlier were they born from the time they should have been born? So we have to deduct that, and so that we can get the true corrected age. And our developmental assessment is based on the corrected age, not the chronological age. So for a term baby, 3 to 4 months, but remember for preterm, you have to use the corrected age. I hope that is clear. We'll clip that. Ifama, how are you? Happy New Year. I'm not sure I've seen you this year. Or I've read you this year. Okay. Good evening. Is giving a 10 months old tiger not drink bad? I really don't think there's anything bad with it. And it, but I'm not quite sure why the pediatrician talked down on me, saying my child should not be taking tiger not drink. Uh, so we pediatricians, we want your baby to take water or milk. That is the best thing for them to take. All right, but drinks from other fruits, which is my own understanding of tiger nuts, it's just like you are extracting orange and the juice, or you're extracting coconut, for example, you extract milk from coconut and all that. There's nothing wrong with those ones. So unless it's something that has been mixed and you've added a lot of sugar, you've added so many things and all that. So those are the things you need. But if it's a natural fruit that you extract yourself from your, normal fruits that you normally would have given your children, I won't worry about that. So, for example, I won't worry about if you extract orange and you squeeze out the juice and give your children, which is the same way I'm looking at your tiger nuts. That is the way I look at it from. So, but more importantly, ensure that your children is eating healthy and all that. But if a doctor or a pediatrician corrects you on anything, you should have asked them that question. So just like why, so that they can explain the reason to you. That is we have a responsibility towards you to tell you what is right, but you also have a right to know. So you can say why, what is wrong with it, and let the pediatrician give you their own explanation. So that's so that you are clear, you are on the same page. So it's always good to clarify things, but it's fine. Akinlabi and Achusia. Good evening, Chief. Why is vaccine not given to preemies based on their corrected age? Uh, Preemies. So when you say preemie, you need to be very specific. But these days we have moved away from not giving preterm babies vaccines. So we give vaccines based on their age, their chronological age. Okay, so chronological age is when we give vaccines to baby, because the baby has been born and that baby needs to be protected, even more than the term babies. Preterm babies are even more susceptible to infections than the term babies. So vaccines, if you know what vaccines do, vaccines are to protect babies against infection. So are you saying we should just let the baby be waiting for days before we give them the BCG vaccine, and that preterm baby is going into the house with all the people with their cough and coming to see the baby? So before, we used to be scared that the preterm baby may not be able to handle the vaccine, or they may not respond well. So we used to delay vaccines, then I think till they are 2 kilos and things like that. But I think we're moving away. I'm not a neonatologist, but as far as I can remember now, I think we've moved away from that. As long as baby is healthy enough, we can give them the vaccine, because everybody needs to be protected. So even 1.5 kilos this year, we'll give them the vaccine. And we give them vaccine according to the age the baby is born, their chronological age, not their corrected age, because they all need the vaccines. They all need to be protected. Okay, because infection will not say, oh, you were a preterm baby, so I will not come near you. They're going to come near them. And if preterm baby are even more susceptible. So unless there are medical reasons for not to give the vaccines, otherwise we will give vaccines to all the babies, even preterm babies, when due, like chronological age due, not a corrected age. So corrected age is only appropriate for growth and development, but in terms of vaccines, no, it doesn't apply. All right, if it says in Guinea an emergency, it can be anemia, can be an emergency or not. So a baby who have anemia who is otherwise well, that is not an emergency. That can be scheduled. But if a child has anemia that is obstructed and the child is vomiting, the anemia is not going back, or is getting strangulated, because that means the intestine or whatever is entrapped in that inside the hernia pouch is going to die, and then you will need surgery anyway. So that is an emergency. So it can be yes and no. So hernia can be an emergency if it is obstructed, if it is strangulated. The child will be ill, the child will be in pain, the child will be vomiting, the child may not be able to pass through. That is an emergency. But if it is child is having the hernia, but the child is otherwise well, eating, not vomiting, no issue, no pain, that is not an emergency. I hope the distinction is clear. Okay, so your son developed it because of the strike going in the government hospital. They've been asking us to check back every 4 weeks. So if they're asking you to check back, that is not an emergency. When you have an emergency hernia, you will know, because your child will be in pain. Trust me, you will know, and you won't. Even the doctors will know. So If they're asking you to check back, it's not an emergency. All right. So that, but they just have to make sure they do it before it turns to an emergency. As much as possible, doctors, we want to do something when it is not an emergency. We have more control. Things are better. The chances the child will come out is better. So, but if it becomes an emergency, the complications are worse. They are worse. So we don't want to do operation as emergencies if we can do it as non-emergency. Okay, we clip. Akinlabi is saying, what is the appropriate weight for a baby who is almost 9 months old, born at 33 weeks? Okay, so I would use your baby as an example of what I've been talking about in terms of corrected age. So your baby was born 33 weeks. Your 33-week-old baby is a was a preterm baby. So that baby was born 7 weeks earlier than normal. So that's 7 weeks earlier than normal. So if your baby is 9 months old, you say it's almost 9 months, you have to be very specific because we are going to be deducting. So let's just say 9 months old for the purpose of calculation. We need to remove 7 weeks from that 9 months old. So to remove 7 weeks from that 9 months old, so if you remove, 4 weeks is 1 month. So that means your baby is 8 months. Then we remove the 3 weeks. That means your baby is like 7 months and maybe 1 week. So this baby is 7 months and 1 week. So that is the corrected age of this 9-month-old baby that was born at 33 weeks. Now, so what is the expected weight for a 7-month-old baby? You didn't tell us the birth weight of the baby because birth weight also matters when we're calculating weight. But an average 7-month-old baby for a term baby, for example, will be weighing about 8 kilos. So that is the average. Remember, it's an average. Can be a little bit less, can be a little bit more, but the average 50% of 7-month-old will weigh 8 kilos. So that is the not, I won't say appropriate age, that would say the average weight. Okay, because if it is a little bit lower, that does not mean it's not appropriate. It has to be, it's a range. Everything is a range. Not everything is not exact figures. There's a range, there's a normal range. So it's like what we call a Gaussian curve. So you can be within certain band and you are still within normal. It is when you begin to fall out of the lower limits or the upper limits, then that we start talking about something is wrong. So an average 7 months, 1 week old should weigh 8 kilos. All right. Thank you for that answer. Indeed, the weight was considered before giving the vaccine at 6 weeks. Yeah, that is what they do before, but now we don't do that anymore. Any baby who is at least 1.5 kilos will be immunized. Doesn't matter. We will immunize them now before they even leave the neonatal unit. Before we don't immunize them, but now we do because we have to protect them as well. All right. Let's go back to Facebook. Okay, I will finish my chat over strategies later on because the same I'm getting stuck with the question. So if Oma, did I finish answering your question? They're on strike and yeah. So you it's up to you really whether you want to go and do it as a private operation or whether you want to wait and do it when the strike is over. How old is your baby? You didn't tell us. Did I say the age of the baby? 2-year-old. Okay, for a 2-year-old, yeah, a 2-year-old with green ania should have the surgery done. It's up to you really. It's not an emergency, but it's up to you if you want to go and do it privately or I don't know when the strike will be over, so I can't comment on that. But if the child is well, it's not an emergency. Abigail is saying the weight is okay, the head is okay, just the height. The weight is okay, the head. What do you mean the head? I'm not sure what you mean. Is it the child that you're talking about, the height? Okay. Yes, I've told you what to do, so just do it. See your doctors, they will do the needful. See a pediatrician, preferably a pediatric endocrinologist in any of our teaching hospitals or federal medical centers. Or some private people also have them as well. All right, okay, let's go on to the next question. Gloria said they are twin babies. One seem not to have gained neck control. They'll be 4 months old. Are they term babies? That's the most important question I want to know. You didn't answer that part. So we need to know whether they are term. Were they twins that were born at term or not? Because if they were twins and they were born at term, if by 4 months one of them does not have neck control, you need to see a pediatrician. And because we also actually know that twin babies, actually the second twin, they are prone to having developmental issues. And so it's very important. But if they were born preterm, we need to correct that. So the most important thing I want to know, Gloria, is when were they born term or were they born preterm? Okay, you said they were born at term. If they were born at term, by that Thursday, if that child doesn't have neck control, you have to go to see a pediatrician. And I'm almost assuming you'll be the second twin. They are usually prone to having that difficult. Actually, if the gap between when the first baby came out and the second baby came out was a little bit long and all that, so it's important. Okay, Oyinda Mola, good evening. Can you advise on the best way to get a 6-month-old baby to feed? Best way to feed, you just be patient with the baby. Okay, there is no best way, there is only one way. You put the food in the mouth, that's all, there's nothing else. Okay, I know you wish I can give you like uh a a what's it called now, something like a magical wand that you just wave it over the baby and the baby will start to eat their food. There's none I can, and there's no drug, so don't ask for any medication. Okay, so the way to feed the baby is to feed them. There's nothing technical about it. There's no rocket science. You put the food in the mouth and you do it patiently. Okay, make sure you are patient with the babies. Most of us, I know, I've been there. We are always in a hurry. Mothers, we have 1,001 things to do. So that feeding is just another tick box in your endless list of activities to do for that day. So you just want to get it done and done. And babies are not going to, they don't care about your itinerary for the day. They're just going to do what they want to do as well. So you got to be patient. And please remember that this baby has been on breast milk for 6 months. So you are just introducing something new to them. It takes time. I know some of us, you go to a new country, they give you their food and you are, straight away you take to it. Some of us can eat anything, even if they kill a snake or any animal, you eat it. But some of us, we are not that adventurous. So that is exactly the same scenario I will give. So for some babies, you give them, they are from breast milk, you put them on complementary feeding, they are fine straight away. But there are some babies, it takes them time to get used to the new food. And when you are starting, you start slow and steady and patiently. So sometimes the first time it may be 1 spoon the baby is going to take. That is fine. I know when mother says the baby is rejecting feed. Basically, what you are saying is that, oh, you've given the baby is not finishing all the quantity that you want the baby to finish. That is fine. Okay, even if it's just only 1 or 2 spoon baby wants to take the first time, that is okay. And remember that when you start complementary feeding, it's just 2 meals a day. The rest is still breast milk. 80% of that baby's food is still breast milk. So keep breastfeeding the baby. Don't worry, the baby is not going to starve, the baby is not going to die. You just, that breast milk is no longer going to be enough. So we want you to give other food, but you can do it gradually. Okay, so the first time you're introducing a new food, even if it's 1 spoon or 3 spoons, it is fine. Don't stress over it. Okay, be patient with the baby, and then the next time it can become 3 or 5 spoons. That is how we increase it. And then you need to keep at it, persistence. Okay, so you offer the same food. We will say you offer the food 13 times before you will say the child is not accepting it. In other words, you keep offering it. Then before you say, okay, this one is rejecting. You can't tell me a 6-month-old has rejected any food because you just started. Okay, you've not even done 2 weeks, so you can't say the baby has rejected nothing. You are just starting, and then you'll be patiently, and then go to our guide section on our group, our Facebook group. We have lots of videos there that tells you how to feed your baby, what to give, even the quantity we have. You're not bottle feeding the baby with complementary feed. You give him a cup and spoon, make sure it's thick porridge, not watery. Make sure the plates, everything looks colorful, very lovely. You be patiently do these things and your baby will get there. So be patient and be persistent. Don't be in a hurry. Make the feeding something pleasant for the baby and for yourself. So we have lots of feeding tips, and obviously we're still going to talk about feeding down the line. So, but just be patient and persistent. Really, that is thing that we actually should be selling to mothers, but mothers don't want they don't want that. So I understand. Okay, if you send in a lot of things. Anything that can be done by sensation about jaundice. I'm sure we talk about jaundice all the time. Where mother go for immunization. Last time the baby had jaundice and they refused to immunize the baby. The nurse advised the son, the baby come back when he goes no proper advice about going to the pediatrician. Yeah, you could have given the advice now. If pharmacists already know, I mean, you just be an ambassador for ATP and give the right advice to that mother. Okay, yes. I wish I was so pained because if I tried to speak, then nobody will attack you. Learn to be Learn to speak up. People tell me all the time. I know ATP people, doctors know them. So when they go to the hospital, they tell them everything and they're like, "Are you a doctor? Are you a nurse?" I'm like, "No, I'm not, but I'm an ATP person," so they know. So if next time, feel free to talk to that mother. You don't have to talk to the health workers. I understand if they may be, some of them may be very saucy. I apologize on their behalf, but you can talk to that mother on your own. I know it takes a village to raise a child. Okay, and something like that, because it's something very serious like jaundice. I would have been happier if you have talked to that mother and say, "Can you take your baby to the hospital?" Because even the health center, they should have done that. I don't know why they didn't do the take the baby's blood for jaundice. Some of these. So we have different level of health centers in Nigeria. So we have the primary health center, which is a common one. Then we have what we call the comprehensive health centers. Those ones usually have doctors. So those one would have been able to do the jaundice test for the baby, and some of them don't have doctors. So if you let me know the area, the name of the place, the name of the health center, I can decide to speak to a colleague who works in that access so that he can go and have that conversation with them. It's very important. No baby, that is what we call missed opportunity. That baby had jaundice, that baby has come to the health center, and we mix that baby being treated. That baby is going to come back to my clinic maybe later on with cerebral palsy. I don't want that. So I would have loved for you to speak up. Please learn to speak up. In Nigeria, we have to speak up for ourselves. So next time you see that scenario, if you are the type that you are bold, you can talk to the health workers nicely, politely. But if you are not, at least talk to the mother. Tell the mother, take your baby to the hospital. Let them do jaundice tests for your baby. Now, jaundice is not a contraindication to vaccine. The baby who has jaundice can still be immunized. That is not the problem. But that immunization is actually not the priority. The jaundice is a priority. Jaundice is an emergency. I always want mothers to take that information. I don't know. I need to plaster it everywhere. Jaundice is an emergency. We need to know the level of jaundice. Nobody should tell anybody to go and just put the baby in the sun. We get that information a lot. Go and put the baby in the sun, go and put them, give them pawpaw water, go and give them ampiclos. Those are not the treatment for jaundice. Okay, when I finish this my child survival strategies, I'll start talking about all this misinformation and wrong information that people get in health, even in health facilities, even on social media, that are dangerous, that are killing our children. I will take that as a series as well, and I'll start putting them in small clips. I realize that people don't have time to listen to my 1 hour lecture, 30 minutes lecture anymore. People attention span in my generation is very small, so people prefer 1 minute. Tell us what you want to tell us in 1 minute or 3 minutes max, and they are gone. So I'm going to be putting all those information out there in short clips of 1 minute, 2 minutes. So let me say this one now. Sunlight, ampiclos, pawpaw water, they are not the treatment for jaundice. Okay, if a child has jaundice, the most important information is the level of that jaundice. If the jaundice is mild, the child may not even need any treatment. But if it is moderate jaundice, the child may need phototherapy. And if the severe jaundice, we may need to change the blood of the baby completely, what we call exchange blood transfusion. Jaundice can damage the brain if it is not treated on time, and the child can die from that. The child can have long-term disability like cerebral palsy and so many other issues. So we must take jaundice seriously. If your child has jaundice, don't just say, I'll give papa water or ampiclos, I'll put the baby to the sun. You have to take the child to the hospital. The level of the jaundice must be ascertained. And even we as pediatricians, we don't rely on our just clinical judgments alone. We always have to take the blood. Nowadays, we have some technology that even without taking blood, we can do what we call transcutaneous kind of test to know the level of jaundice. So I'm not quite sure many of our hospitals have those instruments yet. But so while we don't have that, we must take blood, we must know the level of jaundice, and then we can give you advice. Nobody can advise you on jaundice when they don't know the level of the jaundice, okay? Luckily, 60% of babies have mild jaundice. So 60% of babies, we get away with all this wrong advice of put baby to sunlight, this, that, ampicillars. It's not those drugs that are doing anything or putting, it's the fact that that jaundice is going to clear on its own and it is mild. But those other children who have severe jaundice and we give them that same wrong advice, those are the children that end up having disability, cerebral palsy. Some of them even die because we're giving the wrong advice. It is not one size fits all when it comes to jaundice. We need to know the level of jaundice. It is the level of jaundice that would determine the appropriate treatment. So next time, if you are in that scenario, speak up. It is important because that may be the only salvation of that baby. That baby it may just be you speaking up that will save that baby from death. And I said that with all sense of responsibility. So we really need to make sure. We should also educate our healthcare workers, and I hope they are listening to me. Unfortunately, some of our healthcare workers don't do what they're supposed to do. And ideally, there's what we call standing order that's supposed to tell them what to do in this scenario. But most of them, some people don't do what they're told to do. They just do their own thing. Or some of our cultural beliefs and all that also play a role in all this behavior. But I'm hoping, which is why I really need to know the location, because we can speak to the pediatrician in that location to also go and find out what's happening and try and correct all these issues as well. But next time, please speak up. You may just be the only person that can save that child. I hope this child didn't have severe jaundice, and I hope this child didn't suffer any severe consequence, but it will really be very painful if that's what happened. All right. So, but thank you for bringing it up. At least we will learn from it, and hopefully it won't happen again. All right. My time is up. I need to go. Major Heifers, you are very late. I don't know whether anybody has dropped any question that I didn't answer on Instagram, but we got to go. Your question is on immunization. 2 weeks ago, a set of twins died of penta vaccine, according to what I saw on IG. Be careful what you see on IG. Be careful what to take away from IG. When people die, don't always take what people say on social media. We always have to investigate. The fact that a child took vaccine and apparently they died does not mean it's the vaccine that killed those children. Okay, that is not how we write death certificates. If you don't know the cause of death, we have to do an autopsy. So I will be very, very careful what I take away from social media. I know the anti-vaxxers are quite plenty, all right? So you really, really need to be careful. So be careful what you take away from social media. I will still answer your question. According to the parent of the kids, did not ask them to bath the baby when they are running the temperature. Along the line, the child died. So is it the vaccine? Is it the bathing of the baby? No, I don't think so. So there may be other things going on. See, parents don't say everything when they come to social media. All right, they say what they think, whether sincerely or insincerely, but they will say what they think. It doesn't mean it is correct. Okay, so let's be careful. Okay, I know that is your question. Did the children die from the vaccine or not? I cannot answer that question. Number one, I don't know these babies. I don't even know the scenario of these babies. There are many things I need to know about the baby before I can even say it is something. That is not how we talk about the cause of that. Even if it's a baby I manage myself in the hospital and the baby died, there are some deaths we call it coroner's case. You have to investigate to even know the cause before you can even know what to write. Not to talk of a baby that we don't know what happened and it's only what the mother told us and all that. But let me just be clear by saying, taking penta vaccine does not kill babies. Bathing a baby after giving immunization does not kill babies. What else is in that scenario? None of those things will kill babies. There are many things, there are many reasons why and two kids to die at the same time. There's definitely more going on here. So I don't know this scenario, and I've not I've not even come across it. So, but I worry when people come to social media and put things out like that, because it causes a lot of time parents just say what they say. I would tell you, a lot of time people write on ATP and say, "Oh, you wrote and said this and that," and even what they are saying, this is me, what I've said on my platform, and they are still writing on my platform, but they're even saying it wrong. And I'm like, seriously? I mean, I'm here. You're saying something I said, and you're quoting me wrong. How much more what I said that was not even here, or what you say other people said that we don't even know? So people make mistakes all the time, and sometimes it's not deliberate. It's just human failure, human errors, and all that. But just to say, when people ask me this question all the time, oh, my baby died, what do you think killed the baby? I can never answer that question, because number one, I was never involved in the care of that baby. And even if I was involved in the care of that baby, sometimes I can't see answer the question, and we may need to do an autopsy to answer that question. So, but speculations is not, medicine is not sentimental. No, it's not speculation. I can't just speculate. So what this mother has done is speculate on social media and tied it to the vaccine. Were the children even sick before or after? I will say, nobody knows. Were this preterm baby? Were this baby in the hospital for so long? We don't know. So there are so many things we need to know. But number one, it is never normal for children to die at all. And this kind of death should be investigated. So I hope they took the children to the hospital when it happened. If not, some children they were born with some congenital heart disease that nobody picked up, and we never knew. And so many things. So, but it's very, very unusual for children to die. Two babies at once, very, very unusual. That story itself sounds a little bit unusual. So, yeah. So, I'm very sorry about the death of the babies. No matter what caused the death, it's always painful for us as pediatricians when babies die. So condolences to the family. We don't want children to die. This is one of the reasons I'm here every Monday and having this conversation. So but if my advice would be for the doctors, the best people to answer this question are the people that were involved in the care of that baby. If they've been to the hospital, the doctors, the nurses, where was the baby born, those are the people that can even begin to answer that question. And they may also not have all the answers, but at least they know the children to a certain extent, and they can give some information. In other parts of the world, these deaths will be investigated. The doctors will take blood samples, that autopsy will be done, and then we can now tell you what is the likely cause of that. That is the only way we answer what is the cause of that. It is not by speculation at all on social media. All right, Douglas, Imo State, Owerri. Okay, I know the women, what's it called? Medical Women Association of Imo State. So I know one of the president, and I think she's a pediatrician. So I'm sure she'll be very interested to know that this is happening in Imo State. So I'm going to pass your information to her, and I'm sure she will be able to do something about it, because definitely I'm sure she will not be happy to hear that a child with jaundice was not immunized and the child was sent home. Two things were wrong in that scenario. So I will pass that information on to the Medical Women Association of Imo State. I know the president is a pediatrician, so she'll be very interested. All right, so you say your oh my god, appropriate weight 8 kilos is 8 kilos. Average weight for your 7-month-old, 1 week corrected age is 8 kilos. All right, I think yeah, okay, you can rewatch and listen. Good idea. So thank you so much, everyone. So today I talk about the three out of the child survival strategies. I talk about growth monitoring. I talk about oral rehydration therapy. We'll talk about breastfeeding. The next one should have been immunization, but I did talk a little bit about immunization, so you can just add it as well because it is the eye. But if you still have any question, feel free to post a question on our Facebook group from Mondays to Saturdays. We will be there. And then I think we hope we have all learned about the jaundice case and about the short stature. And we've also talked about the genital length and things like that. So, and of course, let's not speculate about death of children. It's always painful thing. Parents are in grief, so they say a lot of things not necessarily true, but they're in grief. But if you're worried, the best person to ask is your doctors or those who have been involved in the care of the baby. So thank you so much, everyone. Sorry we have gone a little bit later over the time today, but I will see you again next week. We will complete our chat over strategies, hopefully, and then also address any other issues you have. If you have any topic you would like me to talk about, feel free to send me a DM or send us a message on our Facebook group or page, and we'll try and address them in subsequent episode. Thank you so much. Have a wonderful evening, and it is bye bye from me. Bye.